My name is Dr. Nancy Norman Marzella, Dean of Health and Human Sciences, and I would like to welcome everyone to Cecil College Nursing Pinning Ceremony for 2021. Our nursing program is celebrating its 40th anniversary this year. Many of our former graduates continue to distinguish our program with accomplishments in their roles as clinicians, educators, and through contributions to nursing research. We remember former graduates and thank the faculty, staff, and leaders that have contributed to the successes of our program. And we are honored to continue educating future nurses for our community. We are delighted to have the college community and guests join us to celebrate the tremendous accomplishments of our graduates. At this time, I would like to acknowledge the distinguished members of our college community who have been instrumental in support of our nursing program, our nursing students, and the college at large. Thank you to Dr. Mary Way Bolt, President of Cecil College, Mr. Mark Martinson, Chair of the Board of Trustees, Dr. Cindy Teal, Vice Chair, Board of Trustees, and our other trustees include Donna Horgan, Kathleen Kunda, Raymond Schick-Ham, and Michael Sabinico. Also, we would like to thank our college administration, especially Dr. Christy Dreyer, Vice President of Academic Programs. Our nursing program would also like to thank Forrest and Cindy McElwain, who administer the Gloria Odin Scholarship that provides stethoscopes and blood pressure cuffs to incoming nursing students each year. Our nursing department includes our full-time faculty, Assistant Director of Nursing, Dr. Roxanne Rash, Dr. Shirley Garvin, Dr. Cindy Horton, Dr. Lauren Dawson, Associate Professor Mary Kanar, and Assistant Professor Amy Smythe. Our simulation lab coordinator is Melissa Lewis. Our nursing student success coordinator is Stacy Weiser. Our academic progression coordinator is Kathleen Jordan, and our part-time adjunct nursing faculty. Also part of our team is our administrative assistant extraordinaire, Amanda Horn, who keeps the nursing team on track. Amanda spends countless hours behind the scenes to assist students, faculty, and staff. She does an amazing job, and we truly appreciate all that she does on behalf of our students and faculty. This is my last opportunity to speak to you on behalf of the faculty before you graduate, and I would like to take a few moments to reflect on your time in nursing school. How many of you remember receiving your acceptance letter into the program and uploading all of your Castle Branch requirements, or holding a newborn baby? Perhaps you recall offering care for a terminally ill or frightened patient, performing a skill for the first time and nailing it, your first day of clinical, and your last day of clinical, having to introduce yourself to a real live patient or explain why you had to give an injection or hang an IV to an anxious family member. The results of your first exam and the results of your last exam. Making lifelong friends, learning how to work in groups and across healthcare disciplines, going home exhausted but happy. These are some of the memories that will stay with you and sustain you throughout your nursing career. Many of you have already secured your first nursing job and are pursuing or plan to pursue your bachelor's degree and beyond. You will tell us about your future successes on the graduate surveys and when you come back, and possibly even teach for us in the future as nursing faculty. This afternoon, I'm happy to announce that all of you now own your future as a result of your hard work, commitment, and dedication to pursue a career in nursing. For the past 19 years, Gallup has reported that nursing is the most trusted profession. It's also a very flexible career with unlimited possibilities. Whatever path you choose, know that safe, competent, holistic, patient-centered care is what you would expect as a patient and what you will render as a Cecil College nursing graduate. Trust your nursing knowledge and instincts and continue to follow your dreams. Whatever your passion, nurture and care for yourselves and others in the profession so that you can have a healthy and happy future. It has been our privilege to be a part of your nursing education, and we wish you the very best as you enter the nursing profession. You're ready to graduate. Congratulations. I would like to introduce our student speaker, Anita Reed.
Good afternoon, esteemed faculty and staff, special guests, family and friends, and the 43 members of the Cecil College School of Nursing graduating class of 2021. My name is Anita Reed, and it is my sincere pleasure to be with you today to represent Cecil College's 38th Associate Degree of Nursing class. Today is the culmination of years of hard work, fierce determination, gallons of caffeine, many all-nighters, and a lot of tears. Class, I ask you to think back to our first day of nursing school. After weeks of filling out forms, obtaining necessary immunizations, meeting deadlines, and shopping for the perfect stethoscope, we crammed ourselves into room TC 412 for our first day of orientation. Do you remember how excited you were that day? That excitement was quickly replaced with the question we would ask ourselves repeatedly for the next 2 years. What have I done? We spent that first semester learning how to stay afloat, from being taught how to complete a physical assessment, to participating in skills checkoffs, to figuring out how to stay awake while reading hundreds of pages of our textbook and practicing test-taking strategies. Every milestone got us a little further along in our journey. Right about the time we were feeling like we had a handle on things came our next challenge, clinicals. It was here that we learned about providing patient care, from bed baths to med passes, to administering our first injection with sweaty, shaky hands, and learning how to document care. We got our first taste of what it meant to be a nurse. Little did we know, however, that soon nursing school, along with our everyday lives, would be dramatically impacted by a pandemic that has forever changed the world. Those next 2 semesters would pass by just as quickly as the first, and with each one, our knowledge grew exponentially. During this time, we tackled med-surg, adapted to online learning, learned about caring for tiny humans, and just around the time we were getting comfortable treating one patient, they went ahead and added 2 during maternity. Terrifying. Our last semester has been spent fitting together all the pieces. We have explored professionalism and ethics, learned how to juggle the care of multiple patients, practice giving report. It's amazing how your mouth ceases to work when you have to do this, and have begun preparing to take the NCLEX, or as I like to think of it, the Super Bowl of final exams. While each of us has began this journey with our own unique reason for pursuing a career in nursing, we have become a family with a shared mission, positively impacting the lives of those we care for, one patient at a time. Our journey hasn't been easy. Surviving nursing school is hard. Doing it in the midst of a pandemic, even harder. Many of you worked full-time throughout the program. Some of you homeschooled children who were no longer able to go to school due to the pandemic. Some of you got engaged or got married. Some of you had babies. Some of you became grandparents. And some of you suffered the unimaginable loss of loved ones. I am in awe of each of you. Your perseverance, tenacity, and sheer moxie is unrelenting. You should feel a tremendous sense of pride and accomplishment today. Of course, there are a few people that this class owes a world of gratitude to. Family and friends, thank you for every ounce of love, support, and encouragement you have provided to your graduate. You have tolerated our mental breakdowns, fed us, kept us caffeinated, listened to our stories about code browns and catheterizations, and endured countless hours of serving as test patients so we could practice taking vital signs. We know you have missed both our physical and our mental presence, and we have missed you. Thank you for allowing us to chase our dreams. We couldn't have done it without you, and we will be forever grateful for your loyalty and support. To our nursing faculty and clinical instructors, it goes without saying that we want to be you when we grow up. Each of you is the embodiment of what it means to be a nurse. You have been patient, supportive, empathetic, and caring. You have educated, modeled resourcefulness and creativity, and provided a swift dose of reality when we needed it. You advocated for our continued learning when COVID-19 required you to pivot and reorganize. You were our therapists, our cheerleaders, and our constant supporters. You believed in us always, even when we didn't believe in ourselves. We will cherish forever your hilarious professional stories and memorable lectures. Each of you has left an indelible mark in our minds and in our hearts, and for that, this class will be forever grateful. Lastly, to my classmates, Maya Angelou once said, as a nurse, we have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. As you move into the next phase of your nursing journey, I want to remind each of you that you have the skills and the heart to make a sincere difference in the lives of every patient you touch. Class of 2021, we did it. Congratulations and best wishes to you.
Thank you, Anita, for your wonderful speech. And we will now begin our awards with Lauren Dawson.
Each year, the faculty have the privilege of selecting a few nursing graduates for senior awards. These decisions are always difficult because we have so many excellent graduates. To begin, we would like to recognize the class leaders for the class of 2021. This group has worked to help organize this afternoon's ceremony based on input from their colleagues and their advisors. And this is quite an accomplishment, and we thank you so much. Melissa Carr, Lauren Clipper, Hannah Joy Larson, and Corey Newell. The next award will be presented by Mary Kinar.
This award is the Professional Development Award, and it is given to Shannon Lanzetta. This award is given to someone who exemplifies professional growth in nursing, who truly exemplifies what professional development means in nursing, taking advantage of every opportunity to learn and grow, and engaging in thought-provoking discussions in post-conference as well as in class. A student who transitions into a professional role as registered nurse. While many students have done this, Shannon's behavior exemplifies the attributes of professionalism in nursing. She has put her heart and soul into succeeding in nursing. Congratulations, Shannon. The next award will be presented by Cindy Horton.
This award is for clinical expertise, and it goes to 3 students, Jamie Rudy, Brent Gillis, and Amy Dunlap. Clinical expertise is fundamental to quality patient care, and this award is given to the student or students that perform exceptional in the clinical area, that they can combine the application of theoretical knowledge with the performance of clinical skills. Congratulations, Jamie, Brent, and Amy. The next award will be presented by Lauren Dawson.
This award is for clinical growth. This award goes to Elissa Balla. This award is given to the student who has demonstrated a dedication to compassion and competent nursing care in the clinical setting. This student has consistently demonstrated that they want to be the best nurse possible. They have grown from, I'm not sure I can go in and wake them up, to become a strong, skilled, and accomplished nursing student. Congratulations, Elissa. The next award will be presented by Shirley Garvin.
This next award is for Caring Interventions, and the award goes to 2 students, Corey Newell and Anita Reed. Students that receive the Caring Intervention Award, in addition to delivering exceptional competent care, these students have gone above and beyond for their patients. They have combined the best of evidence-based nursing with compassionate care, always recognizing the individuality of each of their patients. These behaviors were consistently demonstrated throughout each clinical rotation. And we would like to congratulate Anita and Corey. Next award will be presented by Amy Smythe.
I will be presenting the award for clinical safety, and that award goes to Wileen Miller. Patient safety is critical when providing nursing care. This award is given to the student whose assessment and observational skills in the clinical setting has prevented harm to their patient. In Wileen's case, she prevented a medication error. This was a potentially dangerous IV medication, and the nursing staff were very impressed with her great catch. Congratulations, Wileen. And the final award will be presented by Roxanne Rash.
This afternoon, it is my honor and privilege to award from Cecil College Nursing Program the Nursing Student Hero Award on behalf of the Josie King Foundation to Kirsten Pinnell. The citation written on the award reads, "Thank you for all that you do each day as you care for patients and their families. Thank you for listening to them and for answering their questions when they are confused and afraid. Thank you for being brave and for never being afraid to speak up when something does not seem right to you. Thank you for looking for the near misses, finding them and fixing them so that your patients will never be harmed. Thank you for the good catches. Thank you for inspiring others to be the best. By working hard to improve communication and teamwork, you create a culture of patient safety, which is making a difference. Thank you for being a hero, the Josie King Foundation." Now Lauren Dawson will share the events that led to the student receiving this award.
I had the opportunity to be Kirsten's clinical instructor for several rotations during her time in the nursing program. Over the past 2 years, I've seen Kirsten develop into a strong advocate for her patients. I recall the first time she had to speak to a primary nurse about an abnormality she discovered prior to a medication administration. I could see how unsure she was with how the nurse would respond to her, a nursing student, about the care of her patient. To her surprise, the nurse was so thankful that she had caught this abnormality, and Kirsten saw firsthand the results of a good catch. And from that moment on, Kirsten would continue to have multiple similar experiences of good catches. Another important component of the Josie King Award is encouraging patients to speak up. On one occasion, Kirsten facilitated this with her patient who was experiencing a new serious diagnosis and one in which he would not recover. It was through Kirsten's truly listening to the patient's wish to learn more about palliative care and communication with the healthcare team that within the hour, the patient had a full palliative consult and the plan of hospital care completely revised to meet the wishes of the patient, which then included being discharged to home where the patient could be at home with family. I have no doubt that Kirsten will continue to advocate for her patients as she transitions to the RN role, and we congratulate her on receiving this award on her dedication to improving patient safety. Congratulations, Kirsten.
Now we will have our Honor Society induction. Our Nursing Honor Society faculty inductees will be presented by Shirley Garvin. The two nursing faculty advisors for our Honor Society are Cindy Horton and Shirley Garvin. Now I would like to introduce Shirley Garvin for the Nursing Honor Society induction.
Cecil College is excited and honored to have one of the inaugural chapters of the Alpha Delta Nu Associate Degree Honor Societies. We are the TAW chapter. There are currently 113 chapters throughout the United States that recognize academic excellence in associate degree nursing programs. This year, we had 11 students that met the academic requirement for the Honor Society. In addition to meeting the academic requirements, students are required to complete a capstone project. This year's project was completed in April and March and featured a narrated PowerPoint presentation on COVID vaccine education. This information will be disseminated throughout the community. The project was sponsored by Christiana Care Union Hospital in collaboration with Cecil College and allowed the students to participate in administering COVID vaccines to hundreds of Cecil County residents, as well as residents in the surrounding areas. Students that participated in administering the vaccine were commended for their professionalism, their knowledge, and their support. We would like to thank our students for sharing their insight, their knowledge, and overall supporting the community with the COVID vaccination program. I will now like to officially induct our 11 members into the Honor Society. Starting off with the President of the Honor Society, Danielle Ewing. Vice President is Gina Handley. Secretary, Kate McQuarrie. Additional members include Lauren Clipper, Kate Fortney, Autumn Leitner, Wileen Miller, Christine Piazza, Lauren Elizabeth Rakes, Ashley Rios, and Callie Shores. Congratulations to all our inductees.
Would Roxanne Rash continue with the reading of the names of the nursing class graduates?
The nursing pin signifies the completion of the initial nursing program. The Cecil College nursing pin, which you see on the screen, was designed by the first class that graduated from our nursing program. Each school of nursing has its own unique nursing pin, and you often find nurses wearing their school nursing pin on their uniform or scrubs. I will now present a list of graduates from this year's nursing class. Brittany Andrews. Brooke Askew. Alyssa Balla. Brooke Bear. Julia Nicole Bradshaw. Kimberly Brown. Melissa Carr. Lauren Clipper. Aaron Coulter. Amy Dunlap. Danielle Ewing. Kate Fortney. Sarah Estelle Funk. Brent Gillis. Gina Handley. Paige Holmes. Stephanie Marie Jackson. Cheyenne Noel Johnson. Shannon Lanzetta. Hannah Joy Larson. Autumn Leitner. Thomas Lee Logan. Caitlin Nicole McQuarrie. Karina Elizabeth Miller. Wileen Miller. Morgan Mitchell. Corey Newell. Kirsten Hanel. Chrissy Piazza. Lauren Elizabeth Grace Rakes. Anita Louise DiTomaso Reed. Jamie Marie Rudy. Ashley Alexandria Rios. Emily Louise Roberts. Mallory Lynn Sharpless. Callie Ann Shore. Terry Smith. Jessica Spleen. Michaela Marie Stacy. Autumn Sierra Taylor. Alex Vanderweel. Jessica Witt. And Brooke Wood. And now Amy Smythe will present the Professional Nursing Pledge.
Most of you have heard of Florence Nightingale, and many of you know that she is the founder of the nursing profession. What you may not know is that she was an innovative woman who was responsible for many practices that were unheard of during her time and are still followed today. For example, hand washing and the prevention of the spread of the disease. That ventilation and air circulation can have a positive impact on healing. That what you eat influences your health. And the idea that caring and healing should include the mind and spirit, not just the body. Miss Nightingale was a holistic nurse. Her trademark during the Crimean War was her lamp. She could be seen throughout the night walking amongst the wounded, shining her lamp to lead the way. The reciting of the Professional Nursing Pledge is a way to honor the heritage and tradition of nursing. Florence Nightingale and all of the other nurses that have come after her. And now I will recite the pledge. In full knowledge of the obligations I am undertaking, I promise to practice professional nursing with all the skills and understanding I possess, without regard to race, creed, color, politics, or social status, sparing no effort to conserve life, to alleviate suffering, and to promote health. I will respect at all times the dignity and the religious beliefs of the clients under my care, holding in the confidence of all personal information entrusted to me, and refraining from any action which might endanger life or health. I will endeavor to keep my professional knowledge and skill at the highest level and give loyal support and cooperation to all members of the health team. I will do my utmost to maintain the highest standards set forth by Cecil College School of Nursing and will endeavor to contribute to the continued advancement of the nursing profession.
Thank you, Amy. At this time, I would like to congratulate the Cecil College Nursing Class of 2021. Thank you so much for joining us for this special occasion. Please enjoy a look back at the past 2 years of our nursing graduates' journey in the PowerPoint presentation to follow this program.